everyone. Today is the 9th day post operation, and as you can see, I'm like an eggplant. Yeah. What do you think? So I'm starting to actually the bruises are much better now. It was at its peak about 3 days ago. You can see it starts from here actually, then it goes all the way down to my chest. Yeah, it's beautiful, right? It's my body's work of art. Yeah. And you can see this side is still much more swollen than this side, right? It's quite defined. The contours still in. I can feel a lot of muscle and swelling. Here is just like soft. I think partly because I have a lot of jaw muscle on my left. I have been chewing on my left side for years. So when I do Botox, I always here is always much more significant than here, and I will tell the doctor to inject more here. So maybe that's why here it's more swollen still. Other than that, the whole process since surgery is painless, really painless. I mean it, zero pain and zero discomfort. No. Discomfort wise, maybe it's me, because all this swelling and blood clotting when I lie down and sleep, sometimes I feel like there's something stuck in my throat. Not stuck, pressing on my breathing pipe, or what do you call it, windpipe. So, but it's not pain, it's just like, and it's not hard to breathe. In fact, I think it's easier to breathe now because my jaw moved forward. But something is like sore feeling around my windpipe. So the feeling I would describe is more sore, not pain, and the sore is like tired because you feel paralyzed. Your muscles can't move, not because it's pain. Okay, I'll show you a close up what they did to my teeth. They actually bind two of their strongest rubber bands to prevent my jaw from moving too much. So I really put a lot of effort just to open my mouth, but it's really better because I can still stuff food here. In the olden days, they tie wires up to both your teeth so you can't move at all, and I think I would be so upset if they do that because by the third day I crave for solid food and I start to stuff soft food into my mouth like porridge, those western soup, creamy soup, some fish. I just put inside my mouth and press with my mouth and swallow. I shouldn't say this, but I actually ate some noodles, but I didn't bite, I didn't grind, I just swallow them as a whole. So actually, I don't know, before they put these rubber bands, not after the surgery, they did this on the third day post my surgery. So before that, I was a bit paranoid that they didn't pull enough. It was only about 4 to 5 mm actually, compared to other people's cases, which I think is like 1 cm at most, but mine is only 4 to 5 mm. So I don't know, he put the rubber bands on the third day, and now I feel like it's over. I feel like I have an underbite now, and see, don't you think so? Do I look like an underbite, a potential underbite, or is it just my lower lips? I think I have a potential underbite. So I don't know, I'll wait for him to remove these rubber bands, and once it's time to adjust the alignment of the teeth, I would trust their professionalism. But other than that, I'm a bit hoping this will go down soon. It's still very thick though, like muscle. I don't even think. So if I put my thing at rest, it is like this. Okay, and so they also moved my chin down by a few mm. I don't know how many, but I did the x-ray and it looks just a little bit. So yeah, like that. Other than that, I've been sleeping a lot, watching a lot of drama. What else? That's all. Yeah. And then I can talk, I think. Although it's not clear, but it's not too bad. And my swelling it's only the 9th day, and I think it's quite good. And of course, it was at its peak on the 3rd and the 4th day. Now only the bruises make it look scary, and it's the Hungry Ghost Festival now in Chinese urban legends. It's a tradition. So someone commented that I look like okay, so this tradition means the gates of the hell is opened now for 1 month. So all the ghosts and spirits are roaming the earth for 1 month to visit their relatives, or just roam around. I haven't witnessed any spiritual, supernatural things yet, but someone commented that maybe the ghost strangled me. Maybe I don't know if you find it funny, but initially I was like, oh my god, and it was quite appropriate because it's the ghost festival in Chinese culture now for 1 month. Other than that, my only fear, okay, no, only two fears. One is that he over adjusted now, that I have a slight underbite look. Because I don't want my lower lip to be more protruding than my upper lip. I want my upper lip to be more protruding than my lower lip, if not equal. But not. This is really, I don't even think it's the swollenness, because my lower lip is about this size originally. Second worry is, you see this contour here, like the dent. How do I show you? Where is it obvious? Okay, here and then here. So it curves in and then it curves again. So I think it's a bit strange. I hope it smoothen out naturally. 2 months later. Now it's like 1, 2, and 3. Right? I'm sure you understand. But I'm brushing teeth is almost impossible. I use a baby toothbrush, just brush the outer surface, and if I open my gap wide enough, I will try to go behind, but I'm not sure where are the stitches, so I don't want to brush on the stitches because it might open the wound. So I didn't do upper jaw, so I brush quite regularly upper jaw, and lower jaw just gentle. And I also buy those pricks toothbrush. Let me show you. You can buy this from Daiso. It's only $2 Sing for 3. Yeah, and this can really help you to reach in between all corners. It's really useful. I think this is one of the best invention ever. And you can like this. This is a large one. They come in different diameters. So this is the thickest. You can buy the small ones, and you can bend So sometimes I will bend them to reach the different corners, but yeah, just clean. And of course, mouthwash, antiseptic mouthwash. I do it like 3-4 times a day after every meal. But I've been sleeping a lot, so 2 meals a day now. What else? Oh, there's some things that I wish I knew. I read up because the doctor didn't tell me, was that sleeping with your head facing up instead of on my side. I like to sleep on my side actually. Sleeping up, I tend to wake up very easily. But for the surgery, I know I should face up, but sometimes I can't take it. I just sleep on my side. So I think I sleep on my side like 90% of the time. Maybe that's why it's like this. The results are not good. Also, lips are very dry, and I'm in Singapore, so it's so humid, right? But my lips were flaking like all the time for the first 5 days, and in fact it's a bit, the pain came because of the skin here. You see, it's a bit sore. Yeah, here it just feels very raw and dry. So lots of lip balm, moisturizer, or chapsticks, and yeah, I haven't applied them yet since 4 hours ago. But now it's much better. On the first and second day, I feel like I'm a snake shedding skin. So it's, you can really literally pull out one piece after piece of dried lip skin. Like it's like a snake shedding its skin because it became too swollen. So you should prepare some lip balm, good ones, vitamin A and D. Yeah, and I think my blood pressure was a bit low, so getting out of bed was a bit difficult. And I mean, I feel a bit light. So other than that, showering. The first 3 days I was a bit cautious, so I didn't wash my hair for 2 days. On the third day, I washed my hair, but I didn't wash it the normal way. I put everything in a basin down and try not to let any water touch my face. So I wash my face by wiping with those micellar water. They call it biodermal water, and that's it. I don't dare to like touch or rub my skin. But on the 5th or 6th day, I use normal facial foam and just very gently rub. Another point is the numbness in here. A lot of bloggers and vloggers said they feel numb. I think I'm very lucky, or I got a good doctor. I actually can. I do feel the pins and needles a bit, but I think it's almost full sensation for me. I don't know if I'm there. Yeah, it's almost, yeah, I can feel everything. Maybe here it's, no, I don't know. I don't know where is the numbness. It's not numb for me, so thank God. And the bad thing is I can't eat all my favorite food. The good thing is I can rest at home. So I'm a bit torn. In a way, I want time to fly as fast as possible because I can't wait to see the results. I can't wait to eat all the solid food. So I think maybe next month. But at the same time, I'm dreading going back to work, and who doesn't want to just be legitimately resting at home and just doing nothing and idling in this, at least I do. So yeah, I don't know which is better, but tomorrow will be the 10th day. Probably I'll do another update 2 weeks. Take care. Bye bye.